leases are coming shortly.
Is that a full 2 meters apart? Close.
Good morning. I'm Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report in the province. That leaves our count at 7 cases. I know there was approximately 400 tests done yesterday, all reported back as negative. Public Health continues to recommend that all international travelers returning to Canada should self-isolate and self-monitor for symptoms for 14 days after returning to Canada. Work is underway to finalize guidelines for healthcare workers and other critical infrastructure workers who return from international travel to ensure we address any impacts on essential services. All Manitobans, including healthcare providers, are strongly advised to cancel or postpone any non-essential international travel. This pandemic is emerging rapidly. Now is not the time to travel outside of Canada. Data is showing us that the vast majority of cases in Canada at present, and certainly in Manitoba, are travel related. So we're asking everyone to cancel or postpone any of the international travel plans. Anyone returning from international travel, please self-isolate and monitor for those symptoms. Call Health Links if any symptoms develop. All physicians, healthcare providers, and staff returning from international travel must self-identify to their organization's occupational health services. I want to discuss testing for COVID-19 again. You can see that CADM Provincial Lab is doing an amazing job at keeping up with the demand on their services, seeing roughly 400 tests being done yesterday. We want to ensure that those tests are being done on the appropriate people. Only people who are symptomatic and returning from international travel need to be tested. People who are symptomatic and also contacts to cases should also be tested. No one without symptoms should be tested for COVID-19. So please do not attend for testing for COVID-19 if you have no symptoms. Employers, please do not send staff for testing for COVID-19 if they do not have symptoms. And healthcare workers should decline to test people without symptoms for COVID-19. At times like this, we often see the best of people brought out. We are getting continuous offers for people to assist us, students, universities, to help us in our battle against the pandemic. It also brings out the worst in some people. There have been multiple phishing scams that have been noted online. People are being asked and called for credit card information from public health. Please do not give out any financial information over the phone. Public health would not be contacting you and requesting that. So do not give out any financial information. I encourage you to report any such scams to the law enforcement agencies. In keeping with social distancing strategies outlined to Manitobans last week, and again with consultation with many key stakeholders, we have advised suspending of classes in Manitoba, K to 12, beginning March 23rd and to April 10th. This is certainly being done to limit the spread of COVID-19. We have not seen community-based transmission. We have not seen cases within our school, but this is out of an abundance of caution to make that recommendation. And again, ideally, we wanted to provide some time for people to prepare for such an endeavor. According to education officials, teachers will be on the job for the week before and the week after spring break. They'll be preparing lessons for students to do at home where possible, and other staff as well may be at work, including cleaning and maintenance. So I just want to stress that classes are suspended, the schools are not closed. Following consultation with public health, all licensed childcare facilities are remaining open at this time. I have to stress that this situation is evolving rapidly. We're reviewing the data, we're reviewing the actions of other jurisdictions constantly. And so we'll amend our recommendations based on the information we receive, and so we'll communicate any changes to the public as soon as possible. Public health officials continue to recommend social distancing measures for all Manitobans, including canceling or postponing any large-scale events that's usually listed at 215 attendees, minimizing prolonged close contact with other individuals, closer than 2 meters, longer than 10 minutes, avoid greetings that involve touching, such as handshakes, disinfecting frequently washed or frequently touched surfaces, following public health advice related to self-monitoring and self-isolation, and specifically those people returning from international travel. We know that the cases here were introduced from international travel. We know the majority of cases in Canada are from international travel, so please follow our advice, self-isolate for those 14 days, call HealthLink should any symptoms develop. And again, I can't stress enough, now is not the time to travel outside of Canada. Please postpone or cancel your travel plans outside of, well, internationally, outside of Canada. A lot of these messages are extra important to those at risk, those over age 65, those with underlying medical conditions, those with immune compromise. Those people should take extra cautions to limit their contact with other people. Do what you can to stay safe. And during these times, you want to make sure we're reaching out to these people, ensuring they're not feeling isolated. So please take care of those that are most vulnerable. So these messages do include St. Patrick's Day tomorrow. So this is including social gatherings, large gatherings at bars and events that would have the inability to maintain social distancing. There will be a time when we get back to these activities, but now is not that time. During this pandemic, we need to be strict with our social distancing strategies. Now is not the time for large group gatherings where this virus can spread. So again, do your part to limit the spread of this virus, avoid these large group gatherings, but there will be a time again, just now is not that time. Employers should review their business continuity plans and take steps to ensure employees can stay home when they're ill. This includes lifting the requirement for sick notes. Again, our healthcare system needs to be responding to the pandemic, not spending time writing notes for ill staff. Employers should discontinue non-essential work-related travel outside of Manitoba and encourage virtual meetings to reduce prolonged close contact between individuals. And again, can't stress enough, wash your hands frequently, cough into the sleeve, sneeze into the sleeve, and stay home when you're ill. Like I said yesterday, many Manitobans are concerned about this. The healthcare system is at the highest level of readiness. I want to stress that this is not the time for fear or panic. This is the time to be prepared, to gather credible information, but it is a time to act. We need to change many things we do in our day-to-day activities to address these social distancing strategies. If we haven't made a change, we haven't started to do our part to limit the spread of this virus. So please pay close attention to these social distancing strategies, see how they can be applied day-to-day in your lives. And again, I stress, I discourage any fear or panic buying or stockpiling of goods at this point. So at this point, we will just again stress that visit our website, Manitoba Health COVID-19, for credible information. Please be prepared. Please use credible information, and please start making these actions to keep our communities, our families, and ourselves safe from COVID-19. Thank you.
Good morning. I'm Lynette Siragusa, Provincial Lead for Health System Integration and Quality, as well as the Chief Nursing Officer for Shared Health. So I will provide you with an update on the operational measures as we continue to respond to COVID-19. But I did want to start today by talking about, reinforcing that we have been working for many weeks to develop a plan and a strategy so that we are prepared and ready to mobilize resources as the need becomes apparent. And I also wanted to talk to you about the tremendous response we've had from the public and educational institutions and organizations. In Manitoba, it's always been clear to me, but more so in times like this where we have the ability to pull together and take care of each other. And it's often in times of crisis that we really are at our best. So I wanted to take the time when we present to just highlight some of the unsung heroes and the people who are stepping up to raise their hand to help us, because it really does take a lot of people. It's a public response. It's a social movement really for us to manage this. So I want to acknowledge all the healthcare providers, our partner organizations, and every individual who's working towards this goal. This weekend has been a really productive weekend. There's lots of meetings and lots of good work that happened. On Saturday, I called the Dean of the Faculty of Health Sciences on his vacation and asked for support. If there were healthcare professionals who could step up and volunteer. We have some priority areas, health links, occupational health, community screening, lab results. And so he's put the call out to all the deans in pharmacy and rehab sciences and dentistry and nursing, and a tremendous response. So I want to thank everyone at the university, the academics, and the students for support. We had within 2 hours, I think 140 medical students who were going to go off to the access centers to help, as well as we have student nurses going into Health Links today. So I suspect over the coming weeks there's going to be a lot of unsung heroes who show up, and I think we should really acknowledge their contribution and dedication. And so I'm going to keep giving you updates on stories of success and commitment, because it's quite inspiring and amazing from my perspective. To give you an update on the access centers, so as mentioned yesterday, a new dedicated testing site for COVID-19 opened this morning in Thompson at the Thompson Clinic in the Plaza Mall. This clinic in Thompson will be open 9 a.m. to 4 p.m. Monday through Friday. As previously mentioned, there are plans to open more dedicated sites this week throughout the province. We anticipate sites in Flin Flon and the Pas will open as soon as tomorrow, and more information on the other locations will be made very soon in the coming day or two. In Winnipeg, the 4 testing sites have seen more than 1,200 patients in the first 4 days, including 321 yesterday. We remind the public that all locations, 5 locations including Thompson, are dedicated testing sites that are intended for referrals only. They are not walk-in clinics. Please call Health Links, where they can assess whether there is a need for you to be tested. If you are not suffering from cold or flu-like symptoms, there is no need for you to be tested at this time, even if you have traveled outside of Canada in the past 14 days. Health Links continues to see high volumes of calls. We received in excess of 1,700 calls yesterday, and the average time was 1 hour and 43 minutes. We are continuing to add staff, and including those U of M nursing students, and we will continue to look at processes to improve that. We'll also be testing a new online self-assessment tool to supplement the HealthLinks line. We hope to have this up and running soon. Visitor restrictions. Elevated visitor restrictions are now being implemented at all healthcare facilities in Manitoba, including long-term care homes. These restrictions are designated to protect patients who may have underlying medical conditions that put them at a greater risk of severe illness due to COVID-19. These restrictions are similar to the ones that HSE implemented as of yesterday in Winnipeg. People who have returned from international travel in the past 14 days are instructed to self-isolate, or if they're experiencing cold or flu-like symptoms, should not visit acute or long-term care facilities. Patients at all acute care facilities, such as hospitals, are now being restricted to one visitor at a time, and exceptions will be made for special circumstances based on individual situations. Visitors who are well will continue to be welcomed at our site, but may be asked direct questions about screening, contacts, and travel history upon arrival. Virtual care. We have been in collaboration with Doctors Manitoba, and there has been an agreement to offer virtual visits and virtual psychotherapy options to supplement traditional models of care, including video conferencing options. This move supports social distancing while still providing patients with the care they require. So we'd like to thank Doctors Manitoba for their willingness and support in moving forward with this initiative, and more details will be provided in the coming days. So wrapping up, I would just like to thank everyone for your support and your questions and your recommendations and suggestions. We are responding to them, and we appreciate it very much. So please keep them coming, and we're happy to respond to any questions you may have.
Dr. Roussin, do you believe community transmission is taking place right now?
There's no evidence of that in Manitoba. We're doing a lot of testing. We have syndromic surveillance in place, and so the only positive tests we've had were related to travel.
Do you believe it's taking place? Not everyone is being kept. Do you believe it is, in Ottawa they say they believe it is taking place?
They have reason to believe that. Right now we're a few days into seeing our first case. All of those have been directly related to travel. All of them have been contained as per our plans. So right now I can't say I expect community transmission at this time.
The province has already increased the number of lines for HealthLinks. We're still hearing from a lot of people that they simply can't get through. People are frustrated. Is that still what is going to happen? You have to go through HealthLinks no matter what to get to one of these clinics.
That's what we're recommending for now, but I think there's some processes that we can do as a system, and we're working towards it. There are people who are calling HealthLinks to get their lab results, and so we need to have a dedicated different process for that, so it's not bogging down the people who are trying to figure out what to do with their symptoms, as well as our intention is very soon to have a technical virtual option where people can almost triage themselves online. So we have the people, we have the phones, we have the computers, we just have to put the technical pieces in place. So if everyone could be patient, we're hoping that will be soon.
Is the testing being prioritized at all? Like, are people who are travelers getting their results first rather than people who just may have been in the community here?
So if you are positive, you get a response first. That's the number one group. And then so if you test positive, then was that your question?
No, like, are you doing the ones with travel history first before the ones who don't have any travel history?
The ones we're testing, you're asking?
Yeah.
They have to have symptoms, though, as well. So only if you have symptoms is when we would test you with that travel history.
I mean, like the test in the lab.
So,
the test. The actual lab, Adam lab.
So they don't really have the ability to be running separate, quicker tests for other individuals. So that's why we're stressing only people who have international travel travel and symptomatic should be tested, or those with close contacts. They don't really have the ability to expedite certain samples. So we want to make sure all the samples being done are appropriate.
Why not shut down visitors to elderly homes and care homes immediately right now if we know that our elderly are some of the ones that are most at risk?
Well, we've put on some significant restrictions to it. There's a balance, right? I mean, that's a huge implication for families, for these individuals. So we're trying a measured approach, trying to do what we can to limit the spread, and we'll continue to amend that as needed. But these are pretty big restrictions right now.
You have
Are
a one
there
person per hospital right now.
preventative?
You have a one person per hospital now. Why wouldn't you have the same for the personal care homes?
Well, I would say the personal care homes are their homes. That's where people live, and we are screening people, families at the door and visitors at the door. They do participate in the care of their loved ones, and we would not hesitate to restrict the screening more and the visitors more. But right now it is partly about life and being close to the people you love. But all the families have received letters, and all the personal care homes are screening. There are some private personal care homes who are ramping that up more and restricting to a higher level, and we very well may get there. But we're just trying to pace ourselves because this is going to be a bit of a journey, and these people rely on their visitors and their family
But
to
when you
support
say
them.
screening, there isn't always a person at every personal care home screening people. Sometimes screening is just a piece of paper on the wall, right?
It can
With
be,
instructions.
yeah. We're looking at getting people, though, volunteers to be available to do that screening.
Why are casinos still allowed to operate at this time? Like, these are large gathering spaces, a lot of elderly people go there as well. Is now the time to start saying we need to be putting restrictions on other places?
These are things that we continually are reviewing. We have the mass gathering recommendations. We have many social distancing recommendations, and a lot of them have been implemented in casinos that do limit the close, prolonged contact. But this is something that we're just reviewing daily, multiple times a day sometimes, and further recommendations on those things will be followed.
Are there any preventative steps being taken in terms of protecting people who are the recipients of home care workers? Any preventative measures being taken in that area?
There is a work team working on adult daycare centers and home care and long-term care and assisted living. So those recommendations will be coming out and communicated soon.
To workers?
Yeah, to workers, yeah. Workers and the public.
No plan in place yet, or is it something that's developing?
It's they're working on it now, but nothing has been communicated yet, but will be soon.
Dr. Roussin, are you going to warn the members of the public if they've been in a location where someone who's had a confirmed case has been traced back to that location? What is the process with that? I know there's investigations taking place, but...
So this is part of the public health process, right? So this exhaustive case finding, so that's why we're testing, and then once we find those cases, we do exhaustive contact follow-up. So again, we're only looking for close contacts. So this is not like, say, measles, where anyone in a room would be exposed to that. We're looking for people who are only close contacts to them. So if there was an at-risk event that we thought, of course, we'll be trying to contact those people. And if we needed to make that public, then we would do it if necessary.
So is
How's
it
that
up
going
to
for-
landlords to put that messaging out, or can they choose to do that if somebody were to be in a building where there was a positive case?
It would be up to public health to make that kind of decision.
How's that going
For
for
the
the
three
confirm
people
330?
that were reported over the weekend, how's the contact tracing going for those?
Yeah,
three?
it's ongoing.
They start immediately?
It starts within hours of receiving that result. The person is contacted, advised of the symptoms, ensure their self-isolate, follow up on their symptoms, and then immediate contact tracing, and then reaching out to those.
You said those people yesterday traveled. You didn't specify domestic or internationally. Can you confirm that it's international?
Right. So there was it was international travel.
Were they related? Where did they go? What's their health status now?
The I know the travel destinations on all of the cases, they're varied. There's some from Europe, some from Asia. The typical spots, there was some travel towards Philippines, South Korea, some parts in Europe.
Can you confirm Egypt and Jordan?
There was one that was a contact in Egypt.
And there's a sign up at 330 St. Mary saying, in the stairwell, saying there was a COVID case here. Can you confirm that that is accurate?
I can't confirm that.
Can you deny it?
No. This is the region of the so that would be the WRHA Public Health would be actively investigating these cases and dealing with them appropriately. Yeah.
Is the province doing anything in terms of monitoring people who are coming in to the airport from either national, international flights? Is that something that's being left to other authorities, or is there anybody at the airport screening people in any way coming back from international flights?
Well, that's done at the federal level. The kiosk has screening for symptoms and international travel. There's information sheets given out to returning international travelers about to self-isolate, and then public health would just be following up if they contacted us.
It's up to the feds to communicate with the province if there's any issue.
Yeah, you're right. So public health is not being notified directly about returning travelers. There would be no way to follow up with each returning international traveler. So they're advised to self-isolate. People from the higher risk areas, Hubei province, Italy, and Iran, are advised to contact public health.
But I would also say that the airport authority is part of our incident management structure, so communication does go to them, and if they have questions, they often will call us and ask for details and clinical guidance.
The virtual doctors, is that for family physicians?
It could be for all physicians.
If a physician wants to do this, they can reach out to you, or is it?
Yeah, we'll work with Doctors Manitoba on the communication strategy, but yes.
The people who are getting tested are being told they will be called back for negative tests. You said on Friday they will not be called back. Can you clear up that confusion?
It was never usually our process in the past to follow up specifically on negative results en masse. But given the situation now, we feel like it's the prudent thing to do to alleviate some of the anxiety and help people get back to work sooner if we can report those negative results. So we are making a process to make sure that those negative results will be reported back.
What's that process?
Well, we're talking about what the options would be. It could be us calling people individually one by one, or providing a 1-800 number. We do have to get whoever's going to be responsible to make those calls have to have access to eChart, which is where the lab results are, and develop recommendations. So you are negative and we recommend you watch for this, watch for that, call a doctor for something else. So just making sure that we have the processes in place, and as part of the surveillance, that we record and make sure that the data is there.
There's some confusion about healthcare workers returning from travel. We have reports, they're anecdotal, that they are not being told to self-isolate for 14 days, that they're needed back sooner or told to report. Can you explain what the process is for those critical workers and whether it's different?
Right, so this is when we make the blanket call for all international travelers to self-isolate for 14 days. Again, that has the other consequences such as workforce capabilities in healthcare. So the process right now is that all returning international travelers who are healthcare workers need to report this to occupational health and their management. If they are deemed to be essential, then there'll be a further risk assessment, and they may be allowed to return given extra precautions.
Dr. Roussin, you guys have been in constant contact with federal counterparts. Do we see this going towards looking like things are going to be shutting down besides essential services in the near future?
You know, I think that we're seeing jurisdictions in Canada suggestive of community transmission. And I think we're moving more and more broadly to these social distancing strategies, and I think that that's the way that things are going to move forward. We saw the CDC in the U.S. Announce guidance that groups of 50 or more should be canceled for the next 8 weeks. So this is something that we're looking at. Again, has big implications, but we will do whatever we think is best for the health of Manitobans.
Would that likely come down from the federal government as opposed to provincial?
Well, something like that would be nice to see a consistent approach across Canada. So it could be a recommendation coming from the Public Health Agency of Canada, but certainly in Manitoba, we will implement things that we think are best for Manitobans.
The call to cancel any or postpone any non-essential international travel, could you see that extended to domestic travel, especially as we see more cases pop up in some of these bigger centers like Toronto, Vancouver? There's still a lot of flights going back and forth to Winnipeg.
Yeah, and I mean, as you can see from any of our recommendations, they can change. This is evolving really rapidly. We're seeing more and more jurisdictions reporting cases. We're seeing jurisdictions reporting that they feel they have community transmission. So absolutely that could change. Certainly our recommendations to healthcare workers was to avoid non-essential travel outside of the province because of a lot of these areas. But absolutely that could change with time.
What can bars and restaurants expect moving forward?
Well, I think that's like we mentioned. Everyone has a role to play, and large group events, crowded events. This is not the time for them, and so moving forward, we're going to expect all Manitobans to play their role in this. And so, as far as announcements or that's more to come on that. But we expect right now, as of last week, for people to start looking at these social distancing strategies, what role they can play in those right now.
Is this just airline travel we're talking about? Like, is it okay to drive, say, to a province over and back? Is there any risk with that?
Are you talking about domestically? So
yeah, like if you're driving somewhere, is it more concerned about being on an airplane?
Yeah, well, it's not actually just the airplane. We're not seeing a lot of transmission occur on airplanes. It's the destination from where you're coming from. And so all international travel, regardless of how you got there, I would discourage strongly. Domestically, we're not strongly discouraging that right now, but it's the exposure at the destination site that we're concerned about. The actual doing contact tracing on airlines, we haven't seen a lot of transmission.
How do they know the difference between the two, whether you got it on the plane or whether you got it in the location that you were at?
Yeah. Well, it's really just the contact investigation. So usually we're looking at people sitting in close contact with a person with a confirmed case. We're not seeing a lot of those people come back as positive.
Ms. Sargusa, last week we asked about some specific numbers, and I'm hoping you can give us updates on reserves of retired nurses and doctors, how many ICU beds, negative pressure rooms, ventilators, masks. Do you have those numbers?
So we do have the numbers. Your question was about isolation rooms, and then also, so we came up with those numbers was 265 ICU spots, and we have, I think it was 100 isolation beds, but we can always make more. We can always build capacity for that.
The Globe and Mail had a chart over the weekend just comparing Manitoba's relative capacity to other provinces. How well positioned do you think we are in the event that we get a spike in acute cases?
Yeah, well, we are expecting and preparing for that. So we have experience with H1N1 and influenza. We have protocols that we follow. We call them surge capacity. So there are a number of steps that would happen if we needed to increase our capacity for COVID-19. And part of it is space, which, we talked about it over the weekend, that if required, we would maybe have to start canceling surgeries so that we could use that bed capacity. We also need to look at supplies and equipment, which we are actively purchasing and ordering and is coming in. So we feel like we're well prepared on that end. And the other is the staffing. And so staffing, what we are looking at is, and we do this with all situations where we need to influx, is looking at really a team-based model of care. So there might not be enough critical care nurses for one-to-one, But if we put people together in a model where they have support from a respiratory therapist and another nurse and a critical care nurse, then together they can take care of a larger group of patients.
And are retired nurses and doctors an option?
Yes, and there's back to work nurses who could easily, not easily, but we would request would step up and work at somewhere like HealthLinks potentially, or I think there's a role for everybody to come and help. So we are not saying no.
We talked about the number of ventilators that we had last week. Was that ones that were available, or does that also include ones that are currently in use and not available if need be?
Yeah, that's a really good question. So obviously we do have patients in critical care right now who are using some of those ventilators, but we are planning, we have many more available to us if we need to. So we feel like we can manage.
What's the average wait time for HealthLinks now?
An hour and 10 minutes.
Oh,
43.
Oh, an hour and 43
So it's
minutes.
growing.
Actually, it's come down from yesterday. It was over 2 hours yesterday.
Okay.
So there is actually a hold option, because when people were trying to get through before, it was just a busy signal. Are they now actually being put into a queue a lot of the time?
Yeah.
Dr. Roussin, can you explain the rationale for, some parents are confused as to why we are closing schools. I know you went into this last week, but why we're closing schools but not this week? Can you explain the public health rationale of that?
Yeah, so this really is a matter of timing. Almost all of the evidence shows that the closing of schools should really occur when we see either cases in schools or when we have sustained community-based transmission. And so we haven't seen either of those with that, and so we knew that it's likely to come. We wanted to take advantage of spring break. Ideally, it would be nice to give that cushion time.
How do you know? How can you be aware of community spread if you're only testing people who've traveled or been in contact with people who've traveled?
We're not only testing people who are. 2 weeks ago, we began testing everyone in ICU and in PCHs, personal care homes, and then as of last week, we're running COVID-19 on all respiratory samples, regardless of whether they ask for it or not.
So you're testing symptomatic people in PCHs?
Well, they will have outbreaks. They often submit respiratory samples for flu outbreaks, regardless of whether they ask for it or not. We're adding
You do
COVID-19
that
to it.
anyway during flu season?
Right.
Yeah,
Yes.
so you add on the COVID-19.
Right. Yeah. Now, somebody being tested for the flu at Children's Hospital, COVID-19 is added to it. Yeah.
Can you say anything about how the 7 people who have tested positive and been confirmed so far are doing?
I don't have specific information on them. This morning, anyways, they were recovering at home from the information that I was provided yesterday.
None of them seriously ill?
Not that I have been informed of, no.
And today there's no new cases to report. What should the public take from that, if anything?
We know the virus is here, and we've been preparing for it, and we know that we need to do what we can to limit the spread of this in our community. So to see days like this where we have 0 cases, it doesn't really tell us anything. It tells us that our healthcare providers are working hard getting those swabs in, that people are taking this seriously and presenting for care, and that our lab is working really hard getting us these results. So I wouldn't make much of the 0 cases. Certainly those are the numbers I like to see, but it's early to make any note of that.
There's been a suggestion in Alberta that schools could be closed for the rest of the year. Is that a possibility here? Is that something that you can't rule out at this point?
I certainly can't rule it out. You could see on my this conference on Friday how quickly things change, right? So we take advantage of the spring break, and so we'll have those weeks, but we're going to be reassessing that all through there and seeing if an extension is required.
Are any lab tests being put on hold or prioritized differently now that there's so many more COVID-19 tests being conducted?
There are certain lab tests that are being done less frequently, and that's been on the advice of people in the expert areas, and then other labs are taking some of the burden from CADM on other tests and taking that on. So yeah, there's lots of people stepping up right now, helping out with our response.
Do you have any sense of how many people may be out there that might be experiencing symptoms and may not be reporting it? Is that something that you're planning for at all? Just curious if there's any that works into your considerations.
Well, it certainly does, and we have modeling studies that look at these type of things. We've based it on what we've seen in different jurisdictions and what we could expect here. So it's just vital that we start increasing our testing, which we have done. We've got great numbers out here, and but it's really tough to say, is there somebody out there who didn't present for it? That's why we give the general messaging. Stay home when you're ill. Right? So if someone stays home with their ill, they happen to just not go for testing, we're limiting the spread of that and other viruses. So it is, right now we do not have evidence of community transmission, and I think that's real right now, but we're going to keep testing.
And it's still the best evidence that asymptomatic people are not likely transmitted. Can you talk about that?
That's right. Again, the vast, almost exclusively, there's literature out there, and it's emerging day by day. Just a paper on the weekend that I was reading that shows that children might have very mild symptoms, so sometimes not detected as symptomatic, and possibly could transmit. So we're reviewing this at the national level. We're reviewing it here, so we're constantly looking at that evidence. But as of right now, we would say that almost exclusively this is spread by symptomatic people through close contact.
Right now, we're kind of going on an honesty basis, asking people to self-isolate that are coming back. We've heard some people that are kind of ignoring that advice. Maybe just reiterate how important it is that we are relying on people to be truthful and to do their part in this.
Right, and this is that role that I've been talking about. So people who are returning from international travel, please be aware that all of our cases are related to international travel here in Manitoba. And so by self-isolating, watching for their symptoms, early presentation, you're not only taking care of yourself, but of people around you and our communities. And the same thing, employers, make it easy for these people to self-isolate. If you make it difficult, if you put a lot of burden on them, they're going to find a way to not self-isolate. So we're all in this together. If we make it impossible for someone and not give them the ability to self-isolate under reasonable circumstances, then they're in a tough spot.
And can you take steps against anybody who's just flagrantly disobeying that?
Yes, yeah. The Public Health Act provides us measures to protect the health of the public, and sometimes coercive means if needed. But in these circumstances, we rarely need these things. Most Manitobans listen to advice and are are aware of the impact they could have on others.
What does that mean, coercive means?
Well, it could include a communicable disease order under the Act to order them to self-isolate. And it could go all the way to an order to apprehend that person if we felt they were an immediate risk to public health.
And you're still doing daily checks on the people who have been asked to self-isolate, who you found through
contact tracing, right. So only close contacts. We wouldn't be aware of people self-isolating just because of international travel, but close contacts of confirmed cases, yes.
Do you call them daily?
Yes. They're required to take their temperature twice a day. We call for follow-up on that, follow-up on symptoms, ensure they're following self-isolation, and see if they have any questions.
Any advice from people who are seeking urgent or emergent care for things that aren't COVID-19 related? If they're calling health links because their kid has something else and they're running into long wait times?
Yeah, at this time, no. We've made 2 different call streams. So there's the COVID-19 call, and then there's everybody else. So breastfeeding and earaches and urinary tract infections, whatever is going through health links, that for now is going to keep going.
So how does that work when you call in, if you get answered immediately, or are you calling for COVID-19 and you dial? Or
no, you just call the number, and then they have a team that's dedicated to the COVID-19 calls, so they can specifically focus on getting those through. We're not recommending, if people need help and guidance in the healthcare system, we still want them to use health links as well.
How are you folks reaching people who speak other languages with all this messaging, besides English and French?
Right, so definitely English and French. We've worked hard to get those translated for certain documents, such as the advice to people who are undergoing testing and what they should do pending results. We have that translated in many languages. And then we have very good interpreter services in healthcare, so anyone who is in contact and we require interpreter services, we can always employ that.
What's the risk for Northern First Nations kiosk, rural hospitals, clinics, these remote communities that have one-way in and out or only air links in and out?
Well, the introduction of the virus there is certainly something that we'd want to minimize. So again, it's all these precautions. So people who are returning from international travel, we want you self-isolating. We certainly don't want you visiting a remote isolated community. People who are sick, you should be staying home. And so these are the kind of these general messages really apply everywhere, but they can really limit that spread if people adhere to it.
What's the plan for the civil service regarding business operations? Or what other advice are you giving? I know that might be beyond your purview. But we've got some questions from those people.
Yeah, so right now the advice is the social distancing strategies, how that can work in your setting. But again, this is evolving rapidly as we see more and more cases here. If we do see community-based transmission, then those recommendations are going to change accordingly.
And one last question. My own manager says HealthLinks is telling some people if they are sick, they should self-monitor but can come to work, whereas you're saying don't do that. Are you aware of that disjunction at all?
The advice should be clear is that anyone who's sick should be at home. Don't go to work or school if you're sick. I don't know what exactly that is.
We'll check on that. Thank you.
All right.
Yeah, just to confirm, you've mentioned this, but people are being tested outside the city of Winnipeg. There's a lot of focus here. Rural areas, testing is
Yes.
happening.
Yes.
Brandon,
Yes.
small towns.
Yes.
Yes, testing is available and we've received samples from all regions.
But we will be identifying specific testing sites. So Thompson being the first today, but there will be more coming online in the coming days.
Are you happy with the response? Do you guys put all your recommendations out there? Are you happy with the way people have responded to this point, to the recommendations to stopping any kind of conferences or events of over 250 people? Are you happy with what you've seen from people so far?
I think I've seen a lot of Manitobans step up and do their part. And so we've been hearing stories. We've all heard of many events that have been canceled. We've heard of employers finding ways to allow some employees to work at home. We've seen people in healthcare step up, coming out of retirement, coming from school to try to help us out. And so I think this is not surprising. This is Manitoba. This is the kind of thing we expect here. But we want to continue to ensure all Manitobans are aware of their role and to really find out that role. We need to change things we're doing day to day. If we're not changing it, then we're not doing our part to limit the spread of this virus.
Anything else?
Is this taking a toll on some mental health? Any advice for people who are struggling with that right now?
I think the messaging to get credible information. Don't spend your time on the internet seeing panicked and fear mongering. Get credible information. Speak with your healthcare provider, but know that our message, all these steps we take, that all these businesses are doing, that people are stepping up, is that we're not helpless. We're ahead of this. We're not seeing community transmission here. We can get ahead of this virus, make changes now, and protect those that are most vulnerable to this. And we all have this role. So think about your role. Don't fear or panic, but get that credible information.
And we also have some documentation that we have created through our crisis response group where people some strategies and tools to deal with the stress that comes with this and some places where they can reach out for help.
Thanks, everyone.
Thanks again for answering all our questions.
Thank you for asking all your questions.